Our group is presenting on marijuana and pain for our TOE presentation, and the members of our group are Taylor Blackburn, Camille Flores, Green Lee, Katarina Nguyen, Coco Swen, and Marlon Tsai.
Our group chose to study the effect of medical marijuana on chronic pain relief. For one, controlling and relieving pain is one of the most important facets of nursing care. Upon further research, our group found that more than 100 million Americans suffer from chronic pain every year, a large portion of our patient population. Most people who experience chronic pain turn to opioid use for pain relief, but opioids can cause harmful and noxious side effects such as constipation, sedation, dizziness, psychological and physical dependence, and possibility of death from respiratory depression. This makes it extremely difficult to take high enough doses for adequate pain relief without suffering from these horrible side effects. However, healthcare providers are increasingly prescribing opioids for pain relief, contributing to the nearly 2 million opioid addictions and 20,000 overdose deaths that occurred in 2015. Our research group posed that medical marijuana may be an effective and even better alternative to such harmful drugs. Our PICO question was as follows: what is the effect of medical marijuana in comparison to opioids in adults over the age of 18 with chronic pain? Our population was adults over the age of 18 with chronic pain. Our intervention was medical marijuana use. The comparison was opioid use. And lastly, the outcome was increased effectiveness of medical marijuana on chronic pain over opioids.
Our criteria for research included articles within the last 5 years. The articles we're looking for included randomized control trials, surveys, prospective studies, and systematic reviews. We found a total of 6 articles using research tools of databases Sinahal and PubMed, using key terms like cannabis, chronic pain, and opioids. According to Johns Hopkins Nursing Evidence-Based Practice Rating Scale, our articles included Level 1A rating for 1 of them, Level 1B for 2 of them, Level 2B for 2 of them, and Level 3B for 1 of the articles. Our articles ranged from 2011 and 2015 and took place in Michigan, the Netherlands, Australia, Canada, all over America, Europe, and South Africa.
Synthesis of results. The concentration of the studies was to explore, examine, and analyze the effects of marijuana on patients with chronic pain. The inclusion criteria involved participants over 18 years of age or older with some type of chronic pain, either systematic or cancer pain. A total of 6 articles were used, which consists of 3 randomized control trials, 2 prospective cohort studies, and 1 retrospective cross-sectional survey. The setting of these studies were held in the following: an online survey in the United States, the random control trials at a medical center in the Netherlands, Americas, Europe, and South Africa, 2 prospective studies in Australia and clinical centers in Canada. The measurements used were online survey that included questionnaires about medical conditions and cannabis use, frequency, and the demographic information. The VAS, or Visual Analog Scale, and Numeric Pain Scale, or NRS, both measure the intensity of pain by images, or a rating scale from 0 to 10, with 0 being no pain and 10 being most painful. The Composite International Diagnostic Interview, or CIDI, was used to make questionnaires about pain management. Brief pain inventory, which is similar to the NRS, uses pain rating out of 10 and also reports of pain relief. The Orbit Scale assists in identifying behavior that relates to opioids that may reflect problems with the treatment. And lastly, the last measurement is the McGill Pain Questionnaire, which measures pain quality such as sensory, affective, and evaluative dimensions of pain.
Continuing on with the synthesis of results, 5 out of 6 of the studies proved the reduction of pain through marijuana. However, 1 of the 6 studies showed no significant decrease in the pain level. The study done by DeVries in 2016 found no significant reduction in pain levels for participants. According to DeVries' study, 62 randomized participants with chronic abdominal pain partook in an experimental study to test the efficacy of THC tablets. 62 participants were placed in the THC group, while 29 were placed in the placebo group. The study found that although THC tablets were proven safe and well tolerated, it did not significantly reduce pain scores in participants. One of the reasons the THC tablets did not have a significant effect on pain relief is due to participants having gastrointestinal disease. The gastrointestinal disease could have affected absorption of the tablets, causing little effect on their pain relief. On the contrary, Bohenke, Latinas, and Claw found that the average number of opioid medication classes were reduced when participants used cannabis. This suggests that cannabis can decrease chronic pain synergistically with less opioid medication. Furthermore, it can be beneficial for chronic pain patients who experience an increase in side effects when using opioids. Another study done by Portnoy in 2012 also yielded positive results and found that high and medium doses of nabiximols, which is a mouth spray with cannabis extract, did not induce pain reduction, but low doses of nabiximols were proven to be effective in pain management in cancer patients.
Recommendations. All studies agree that further testing should be done to monitor the adverse effects of cannabis. Thus far, the effects and therapeutic dosages of cannabis are still unknown, and even though there is evidence of therapeutic effects, the extent to which cannabis relieves pain is still unknown. The time frame of each experiment should be prolonged in order to increase the accuracy and validity of the effects of cannabis on pain relief. It may be beneficial to use subjects who have not been exposed to marijuana before, so that the true effects of marijuana on the body can be evaluated. Some of the studies evaluated the use of opioids and cannabis together. However, this makes it difficult to examine the extent of which cannabis decreases chronic pain. It is difficult to differentiate which effects are caused by the cannabis and which by opioids. Overall, if these recommendations are followed, more information about medical marijuana can be discovered, leading to a higher probability of physicians prescribing it for pain.
I'm going to be talking about how you can apply our presentation to clinical practice. 5 out of the 6 studies cited in the previous slide containing the synthesis of results provided evidence that support cannabis use is used effectively among chronic pain patients as a pain medication, used either adjunctively with or instead of opioids. The article by DeVries et al. Published in 2016 and Ware et al. Published in 2015 confirmed the use of cannabis to alleviate pain was safe. This information can be implemented into nursing practice by bringing awareness to the patient's use of cannabis for chronic pain. Some nurses may be biased of patients that use cannabis, though according to Despand et al. In 2015, cannabis use can be beneficial toward pain relief. Cannabis use may change the future of medicine for chronic pain. Right now, the use of cannabis is not as popular as the use of opioids for pain, but could become more common as time goes by, as more patients try it and as more studies are done to investigate its efficacy as well as its potential side effects. So, when we are in clinical, we should be unbiased to the patients who use cannabis for chronic pain. Instead of judging them, we can ask them questions to see why they are using it, how well it's been working for them, and if they have been experiencing any side effects. All of these articles prove that there are benefits to using cannabis for chronic pain and that it can decrease the patient's pain scale. And this is our reference page. We hoped you enjoyed our presentation and learned more about the use of marijuana for chronic pain, and we hope you implement this knowledge into your future clinical practice as a nurse.